Good morning. I'm in opposition to this bill. My name is Brian Tingley, and I'm a licensed marriage and family therapist with 16 years of professional counseling experience. I've taught human relations and psychology at 2 Washington State colleges. I worked as a television writer and producer for a CBS network affiliate and have received numerous awards for television programs addressing children and adolescents, including identity and sexuality. I have 30 years experience as a youth leader, educator, mentor, as well as being a child and adult mental health specialist. My training and life experience causes me to have grave reservations regarding this bill. I've never marketed or advertised or promoted myself as a counselor that works with lesbian, gay, or bisexual, transgender issues. This is not something I'm known for that I ask for. However, through sources like insurance companies and the internet, people with these concerns find me and seek my services. Some of them include individuals with unwanted same-sex attraction, and to my surprise, many of them have been teenagers. These clients exist and they want support. They hear the messages from their parents, peers, political arena, and they're looking for a safe place to explore, work towards their goals, and to talk about things that are taboo everywhere else. I read as fast as I could. I have half more to go, and my written testimony has been submitted.
All right, thank you. So if I hear a couple of you correctly, what you're saying is that you want a safe place to go to have an open discussion, but you think that this bill would limit your ability to have that open discussion. Is that what I heard?
The bill sounds very noble, aversion therapy, but under there is sexual change orientation efforts, which also would probably be something that I would disagree with. But under that, the definition of what sexual change orientation efforts is basically what we do. We talk about things that people can't talk about anywhere else. We try and understand people's thoughts, feelings, emotions, behaviors, and this bill allows that to be, would make that shut down and make it, for me, a clinician to be penalized.
And so you have provided us, but enough that we'd have the ability to contact you with questions?
Yes.
Thank you. Thank you very much. Any other questions?
I have a question.
Senator Frost, before you leave.
So thank you for your testimony. My understanding is that there's a health impact review that was done, and it indicates, and I'm just going to read to you the summary, and it says that a fair amount of evidence indicates that prohibiting the use of specific aversion therapies in the treatment of minors would decrease the risk of harm and improve health outcomes for LGBTQ patients. I'm wondering if you could respond to that, and do you think that's not a valid impact health study that was done? I mean, what's the response?
Are you speaking specifically of aversion therapies?
Yes.
Yeah, I mean, I don't think we can put people in tubs of ice anymore. But people, I mean, clinicians that are trained and do good therapy allow people to come and explore things, what they're feeling. Let me give you an example. I work with a lot of ADHD kids. So if you put it under certain personalities, you put them under certain conditions, they're going to have certain behaviors. Biologically, we know that their dopamine levels are low, which influences how they experience the world. And so then somebody has to interpret that, which the professionals do, and they put definitions and labels on them. Our job, and then they either call them disorders or personalities, that's the medical world. Our job as clinicians is to take that information, help people understand it, and then they get to decide what to do with it for their lives. And that's all we're trying to do here. This bill would prohibit that from happening.
Senator Angel and then Senator Jayapal.
Thank you, Madam Chair. So I think what I'm hearing from you, bottom line, is you believe that this situation and relationship is between the therapist and the patient, no matter what side they may be coming to discuss.
Yeah, I would agree with that.
Thank you.
But also, I think it's even, this bill prohibits, it's directed towards minors. Does it make any sense for minors or teenagers that are wrestling with their sexual drive and all the other developmental changes that are going on in their life to let us trained professionals not work with them, but make it illegal, and then they go to non-professionals and try and sort through that? It doesn't make any sense, and it's certainly not safe for the youth.
Thank you.
And Senator Jayapal, please.
Thank you, Madam Chair. I had a question about how you think this bill would, because as I understand it, you're saying this might stop you from giving support, counseling, advice to people who are trying to process things that they're hearing on the outside. But when I look at the definition of sexual orientation change efforts in the bill, it specifically talks about a regime that seeks to change an individual's behavior. It seems to me it's fairly clear that it's a series of things, and then it goes on to say doesn't include psychotherapies that provide a certain number of things. So can you give me a little more clarity on exactly why you think the language in this would prevent you from offering the type of counseling that you're talking about?
So people come to therapy because they're needing something and they're wanting something. They usually come in, sometimes they know what they want, sometimes they don't, but they set goals. Our job is to help them sort through what they're feeling, what they're doing, and then we don't tell them what to do or how to live their lives. They discover themselves as they're going along in the process. This, efforts to change behaviors, reducing sexual attractions, or reducing attractions. I mean, people need to understand, I'm a marriage and family therapist. Our field looks at all the different influences that make up a person, the genetics, the background, and people's choices. And all these things impact. Think about it, who you've been attracted to in your life. Think about your own spouse. Sometimes you like them, sometimes you hate them. Come and talk to me and I'll tell you, we'll probably figure out why that is. So it's complicated. It's not like we can, this language says, okay, we can't talk about that. We can't deal with that. It just shuts down that processing. And it makes it, and it's kind of a motive thing. It's saying that we as the clinicians have a motive. Who's going to, and also the client who comes in, it's their motive. I don't tell my clients, there's all kinds of people that come in that have lifestyles or beliefs that are differing than mine, but my goal is to help them with their goals and to get them where they want to be. I do that for, I have lots of gay, lesbian, bisexual clients. I support what they want. I have in my family, friends, colleagues. I have good relationships with them, but the people that come in and want to explore this and they're having problems with that, we explore it. And this bill kind of makes that taboo.
Okay. Thank you. And Senator Dan Meyer has a question, and for the sake of time, we do have one more bill to hear, so if we can keep our responses really as short as possible.
Thank you, Madam Chair. So I just want to make sure that I understand the issue that you're bringing forward. I think what I'm hearing from you is under the definition of prohibited aversion therapy, it talks about therapy involving sexual orientation change efforts, and in the definition of sexual orientation change efforts, that's where you get to the softer language about seeks to change an individual's sexual orientation. I mean, that's where you're getting concerned about talk therapy versus ice baths and things like that. Is that what, am I hearing that correctly?
There's definitely a difference, yes. I mean, one is physical, an association. Another is a person learning about themselves and processing what drives them and what motivates them, even discovering what their needs are. I mean, our sexual drives are complicated, and a lot of times it's driven by other needs. And so we just simply help people process that and understand about themselves. They get to decide what they do with it. I don't tell people what to do or what not to do. I don't try to determine their goals for their lives. And this is, again, this is especially crucial in this developmental time. The brain grows until 25. These are, teenagers, it's a critical time in their life where they need to process things, the experiences that they have and they're going through in this season of their life influence them for the rest of their lives. To be able to do that with a professional clinician that's trained, knows what to do, knows how to handle it and support them, doesn't tell them how to live their lives or what to do. That is counterproductive to a maturing adolescent. For a clinician to do that, it's unethical. Again, it's against all the rules. And I might add one more thing, too.
And I'm going to have to actually stop yet, because I would like to hear more, but we have Senator Leas here we're going to give him 1 minute to talk about his bill, because we have one more bill and we're going to hear it, by gosh.
Thank you very much.
Thank you.